it's taken a lot to get here and to get this going. I mean, it's going, but it seems like every time, we have obstacles to face, which isn't that what life's all about anyways? So we're just learning and practicing, just practicing.
Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is. And we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
I think we started the last episode talking about how much trouble it's been to get this thing going, and nothing's changed. And our topic today is humor in healthcare.
Yeah.
And what it is. So,
yeah.
I don't know. We've had to just laugh through this. It's a comedy of errors for us. I don't know if I may be repeating myself from last time, but when we first started working on this, I was overwhelmed with the technology, and you said, "Oh, it's just like setting up for an open heart. We'll just get used to it, and we'll get the routine down, and it'll be just like doing an open heart." And I was like, "Oh yeah, no, we can totally do this." And then like 2 months later, 2 months later.
Well, and it's like, if you remember how every time we would get a balloon pump, we would have to do the cable to get the numbers up on the monitor. We'd have to get the cables in, and then we'd have to get them right. And it was a whole setup process. And then we had to string them behind the bed and get them clear up to the tower so that they would pull that information over. And every single time we would be like, it's not right. Like something's not right. The numbers aren't up there. The SWAN readings aren't right. And it was, and you feel like you're doing it the same way. And so we keep doing this the same way. And then ultimately something is just not right. So today I ended up, and it's been a Wi-Fi issue for me, but today I ended up at my daughter's house, which is good. She just lives in town, but she does have a dog, Remington. And so he may bark every once in a while, but you know what? Don't we all have pets? Well, you don't have a pet. Do you have a pet?
Don't.
No.
Not yet. I want to get a pet? Have I ever told you my idea about having a nursing service dog?
That would be amazing.
It would be so amazing. Like get some little booties for it and like train it to recognize when a Foley is full. So like if you're on CBI, your dog could run into the room and be like, bark a certain way.
Yeah.
And then that it's the Foley or the CBI,
Well, they can be trained.
Yeah, they can be trained. They can detect cancer. Like, why can't we have nursing service dogs that are trained to smell troponins?
Blood sugar.
They hit the door. The patient hits the door and the dog's like, starts
that could be very doable, honestly.
Yeah. Why not?
They can sense seizures, they can sense blood sugars, they can sense lots of things.
And then just like the companionship of having
like an assistant.
Like a friend that's helping you.
Yeah.
I mean, that's kind of what
It's so
we do
amazing.
for ourselves, but
Yeah, like you
yeah,
just bring him with you to
yeah,
work. It's a
yeah,
combo. Huh,
yeah. I mean,
yeah,
they do it for cops.
yeah,
Yeah, I
the
mean,
same thing. Yeah,
I don't know why we can't do that. I
I think it
mean,
could be done.
they'd have to have the booties, like, so they're not
Dropping
tracking,
hair
you'd
everywhere.
have to
Yeah.
yeah, like, maybe it could be something that the dog steps into to put a new booty on, like, it's trained to I mean, I'm just in dream mode right now,
Well, I think
like
that's great. Yeah.
step in, it puts a new booty on, it knows how to take it off properly.
Yeah. Yeah.
No, it can't be with its mouth because then it'd
Oh,
infect
true.
itself,
Yeah,
but
no,
maybe,
that's true.
like
Oh, they'd have to like step on it or something. Yeah,
yeah,
that'd be
yeah.
good. Yeah.
I mean,
Well,
isn't that what we do? We take the gloves off our
yeah,
paws
yeah, yeah.
without touching
Inside out.
ourselves.
Yeah, inside out. Oh God. I'll never forget during COVID, they thought that we all needed to be retaught about how to don and doff a gown and all the equipment. And uh, the infectious disease nurse was up there and the infectious disease doctor was up there. And I was just playing along. They wanted like everybody to do an example and no one would go first. So I was like, I'll go. And, just it was so silly, but like they think there's this perfect way to like take it off, without touching anything. And you might
Mhm.
be able to, but it's so gross. And I just remember thinking, this is what you're worried about? Like
Yeah.
this?
This
Me
is it.
me
This is the
doing
thing.
this hand first, or whether I roll it this way or put it in this way. Like, let's talk about all these people who are dying and we don't have anything to do to take care of them. But this is what we're worried about today. Like,
Right, right.
what? Well, so we are going to talk about humor, and humor not only just in healthcare. We'll talk a lot about how and why it works, kind of the insides of how nurses use humor with each other. So,
Mhm.
not only in their practice, but just with each other in especially, intense, high intensity kind of stressful situations, and why it works, and why some people are leery of joining in, or maybe that they think it's not professional, when in reality it's necessary.
Mhm. Well, I just thought of a funny thing that I do. I've been doing it for ages. I don't know if it started in the PACU or if I started doing it in the ER. I think I might have started when I went to work in the ER. I was discharging a lot of people.
Mhm.
Um, Whenever I have somebody that's super old, you know, and it's appropriate to make a joke, when it's time to cut their wristband off, their ID band,
Mhm.
I always ask them if they wanna save it for their baby book.
Oh, funny. Oh god. Well, the joke also in when I work PACU, like recovery room, when you say, like, specifically GI lab, with like propofol use, and you
Uh-huh.
say, for the next 24 hours, we don't want you to drive, we don't want you to go back to work, we don't want you to make any important decisions or sign any important papers. Like, every time. It's like, oh, the husband and wife will be like, "Oh, well, now we can't go to the bank and get change the will,"
Yeah,
and you're like, God, I mean, every time. And
every
I'm
time.
trying to think, like, is there another way that I can say that? But I mean, there just really isn't. I mean, and you have to
Right.
say the things, but every time
Yeah,
they're like, "Well, guess we won't be able to go to the bank then."
yeah.
But again, I
It
think it's
is
them.
every time.
It really is every time. But I think it's the patient then also throwing in some humor of like, what just happened to me and now I'm
Uh-huh.
gonna go home, and I think it's very natural to for most people to throw in just humor, maybe when they're uncomfortable, or, you
Mhm.
know, just any of those little situations, I think. So I was looking up like kind of the science. I love the science behind stuff and what happens in the brain and things. And so I was looking stuff up about humor and some psychological benefits of it. So one is stress relief, and that is caused by a reduction in cortisol levels. So
Mm,
humor can reduce levels of cortisol, which is a stress hormone, and it helps alleviate the psychological stress effects of stress. So I mean, if you think what cortisol is as a hormone and how it's used and when it's used and how damaging it can be, in any stressful situation that's heightened and your senses are heightened and your mind and that's cortisol. That's cortisol
mhm,
surging. And
mhm.
so, to be able to bring that down to a normal level, whether it's during what's happening or kind of afterwards. You know how after there's a lot of humor after too. It's like you have a big stressful situation and then you kind of come out to the desk and you're all like, coming down off of that, sitting, charting, and then someone will turn around, and make like the funniest comment about it. And then you're all just busted out laughing. And it's the
Yeah.
silliest thing, but it's like it just helps so much because can you imagine if there were no laughter? Like, can
Mm.
you imagine it? It would be so draining and terrible.
I mean, it would be it would be hell.
It really would. It
Hell.
really would.
I mean, it's already bad enough.
I know, and just to know there was another one, a emotional regulation is
Mm,
mood enhancement. Humor can improve mood and increase feelings of happiness and relaxation, which is obvious. Counteracting negative emotions like sadness and anger. So it has a counterbalance mechanism. And then social bonding. Shared laughter strengthens social bonds and creates a sense of connection and support, which is crucial during traumatic times. So really, when someone cracks a joke like that, and all 3 or 4 nurses around the pod look at and it's like you're connecting on that humor level, which is super important as well because you just connected on a super stressful, high energy, high intensity situation, but now you can also just like, you know
well, that's super interesting. So I wanna connect that to the idea of left brain, right brain,
Mhm,
that we're in this objective, reasoned, intellectual state. We're trying to observe what the reality of this situation is, the whatever the bad situation is, we're trying to observe all of the information that we possibly can, which is an intellect function.
mm,
And then which is the left side of the brain. And then the right side of the brain is creativity. And the creativity of a joke takes you out of that intellect and moves you into more of the subjective mind state. And because still in that place where you have to function and perform, so that the joke breaks the tension of the intellect and gives it freedom to move.
mhm, mhm.
And
Yeah.
then the bonding that happens when you're in that is that you've shared this brain shift from left to right and back to right to left.
Yeah.
And so you're dancing between the 2 sides of the brain together, and that's a very bonded activity.
It is. That's so interesting. And, that it explains why you can feel the shift. You can literally feel the shift. And
Mm,
and everybody
mhm.
feels it kind of at the same time, which is magical, really.
Like
Yeah.
like in a really terrible situation, like at one of which is what we share. That's what we
Yeah.
share
Right.
is a a decade of really terrible experiences,
Yeah. Yeah.
navigating the worst possible situations you can
Right.
imagine.
Right.
Um, yeah. So let's you wanna walk into one of those situations?
Yes.
Yeah?
Yeah.
Like, I mean, we kinda talked about this earlier, just the
Yeah.
idea of a situation we were in where a trach went bad
Yeah.
and was this cat was bleeding out, and what was the I think we were messing with the obturator, and
Uh-huh.
and it pops a superficial artery and blood's just going everywhere. And everyone in the room knows the tension in the room. Like it's obvious, like this is a really bad situation.
Yeah.
And there's the reality, everyone is aware of the reality. And then I think you said, well, that's not good.
Right.
I mean, it's like so simple, it's such a simple, it's not even, I mean, it's just stating that the the
Yeah.
reality of the situation, the obvious
Yeah.
reality.
Yeah. It's almost like we're all thinking up here to where what needs to be done? What are we gonna do next? Who are we gonna call? When is this gonna stop? Is it gonna stop? Do we need to go to the OR? Do we need to get the stuff out?
Right.
Where's the trach cart? Where's the this? Where's that? But then and so that can be very grounding.
Mhm.
And so I feel like when you say something like that, it's almost like a ground, like
Mhm.
pulling back down to like, okay, that's not supposed to happen.
Uh-huh.
So, you know,
Blood's
and I
not
think
supposed to squirt out of there.
that's and yeah, like I need some gauze.
Yeah,
Yeah.
lots and
Well,
lots of gauze.
and I think
Mhm.
over the years, I don't even know if I really realized it, but I felt that when I would say things that would kind of lighten the mood, things went better. People could
Mhm.
breathe, they could think better. It wasn't mass hysteria. It was, a calmer, more controlled environment, when you throw a couple of those, crazy things out, not being disrespectful, not being ugly. It's just a humor, a lightening of the mood. It can be anything, like you said, stating the obvious, you
Mhm.
know, whatever it is that, and I think more people should say things. I think they're
Mhm.
afraid, that they're going to be judged by somebody else. But, and of course we did work the night shift and, we had a lot more time away
Autonomy and
from
yeah.
just away from administration, I mean, of course, you're
Mhm.
not gonna act like an asshole, in front of administration when they're there, but, I mean, I can think of times where there was physicians in the room, probably the supervisor, it just makes everybody feel that, like, take a breath, everybody knows what to do, and y y and I'm here with you also, kind of, you know? Like,
Mhm.
I hear you, I
Mhm.
feel this as well, and I think it's a sense of them knowing that I was always there to help, and that was part of it, that, like, I'm right here with you.
I mean, it's just like a
Um,
knife through the tension.
it is like a knife through the tension, and I
Yeah.
think that left brain, right brain is huge with it. It's a literal shift of
Uh-huh.
the energy
The
of what's
consciousness
going on, of the
of of
consciousness.
of
Yeah,
everyone's consciousness, it's
yeah,
shifting,
together.
from together all at
Yeah,
one moment, and
yeah,
then, I mean, that's the bond, is that you've
yeah,
just moved into an entirely new brain space where
yeah.
because you're processing everything so fast,
Mhm.
and then the joke hits, because it's not like you say, "Oh, that's not supposed," "That's not good." Like,
Yeah.
you don't say that, if you say that immediately, it doesn't have as much weight as if there's the dramatic pause between everyone just holding their breath like,
Yeah,
"Oh, shit.
yeah,
What just happened?" Like, we're in a situation now. We're in a new world
yeah,
now.
yeah,
And then that joke hits, and everybody just goes, "Boom," over
uh-huh,
here, and then we're moving, and we're getting it
right,
done, and
yeah,
taking care of everything that needs to be taken care of, because there's this whole world of
yeah,
activity that happens once the critical event begins.
yeah,
And
yeah,
the humor, when you don't have that humor, and I think, I know that there have been a handful of times, not very many, but I've said something in a situation with a family member where they didn't receive it well at all.
mhm,
And I think, like, if there's if in our audience there are people that, are non-healthcare workers, if people understood the value of humor in this setting, they would never get upset with us for what we need to say in the moment.
Yeah.
I mean, there are things that you just can't say.
Right.
And
Right.
and there are, there's always that one nurse that always says the
Yeah.
thing that can't be said, and everyone's just like, "No, no, not
Yeah.
her, not her,
Oh
or
God.
not
Yeah.
you." Oh my
Yeah.
god.
Oh yeah. I can
Yeah.
think a couple of those. Yeah.
Yeah. Yeah.
And so, it is sometimes about timing. It is about presence, kind of who is around. But, as a nurse, most of us can differentiate appropriate from inappropriate,
Mhm.
and I think there's a lot more appropriate humor that can be misstrued by, family members or other nurses, that is like that, they may feel like it's in poor taste, and sometimes it might be. But I
Mhm.
mean, look what we're doing. I
Yeah.
mean, I when I go into a room and there's liquid poop dripping off of the end of the bed, what I can't there's nothing to say.
There's
Like,
nothing to
I'm
say.
just laughing, like, "Are you kidding? Are you kidding?
Ah,
What?"
ah.
And so then for me, it just begins there, and,
Right.
I mean, it just I because 'cause I'm not gonna go into it, like, angry, because I'm not angry at my work, but
Uh-huh.
it's just the things that we don't really love to do. It's easier to do when you have some humor, when you have a
Mm.
lightheartedness about it, because
Right.
you are caring for the patient, and that's what the bottom line is, and we all
Mhm.
want to do that, but there are
Yeah.
certain parts of our job that are literally disgusting,
Yeah.
and stuff that, like, normal people do not see or smell,
Mhm. Yeah.
and that, if it takes humor to deal and to get through those hard times, then I think it's necessary. I mean, it's clearly,
It's
helpful, you
it's
know?
obviously helpful,
Yeah.
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 I think
Yeah.
it does go back to that, the whole idea of healthcare workers being siloed into an experience that historically has been shared by everyone. That,
Mhm.
family members used to take care of their own family, and now we are siloed. And while I think that's one of the special bonds that nurses have with each other, is just all of that, that we are somewhat socially isolated in our experience.
Yeah.
And yeah, I think that kind of informs why I speak to the non-healthcare workers that would be listening to this, that, you know, they would see and approach their nurses slightly
Yeah.
more with more empathy and compassion.
Yeah. Because,
Yeah.
a family member, you can clean up your child, you can clean up your mother, and it's
Mm,
nothing, it's family. But I if I have to clean up poop dripping off the bed, I've never met you. I don't even know you.
yeah,
I
yeah,
have to
yeah.
turn you and clean your crevices. I don't
Uh-huh.
know you, and you
Yeah.
don't know me.
Yeah.
So it's kinda awkward, and
Yeah.
to get through
Kinda.
that a little bit, I mean, I can even remember using humor even in nursing school. Like, I was a CNA for probably at least 4 years before I was a nurse, and so I had been around patients and poop and pee and diapers and turning and bathing and, all of the stuff. And
Mhm.
several of the nurses who were in my little cohort were not. They had never been a CNA before. And
Mhm.
so it was like it's almost like breaking the ice a little bit to kind of crack
Mhm.
the rigidness,
Uh-huh.
and make it seem like it's okay, like, to get in there and, use your hands and, touch the people and using kind of jovial energy it just makes it easier. It makes it easier for them. And, when you're going to walk into a room and you have to give a presentation kind of on your patient in front of the doctor, or morning rounds, like when
Yeah.
the doctor and the dietitian and the supervisor and this and that and pulmonologist and whatever. And here you are, you got to stand up, you got to say, you got to talk about your patient.
Yeah,
There's a lot of nurses who are not comfortable doing that. So it's like, if you can add a little humor in, it just, I don't know, it just eases the tension,
Mhm.
and I think, like it literally re-regulates or manipulates hormones and neurotransmitters. And
Mhm.
yeah, here's some neurological benefit. Humor activates the brain's reward pathways, releasing dopamine, which enhances mood and promotes a sense of pleasure and reward. It also has neuroplasticity. Engaging in humor and laughter can promote neuroplasticity, the brain's
Yeah.
ability to reorganize itself by forming new neural connections, which is beneficial for emotional resilience. So even just the practice of laughing, you
Uh-huh.
know, I mean, they say there's like, they do that fake laughing.
Yes.
Yeah.
I was gonna suggest that at some
Yeah.
point,
Yeah,
that
it's
we
so
should just,
hilarious. It's so
like, fake
hilarious
laugh.
because
Yeah.
yeah, you start this is funny, but when I quit drinking, I went to an intensive outpatient treatment center, whatever it was, for like, it was like preschool, because I went like in the morning. And so
Uh-huh.
I went like from, I don't know, like 9 to 12:30 or something like that. But anyways, one of the things that we did was he made us laugh, like fake
Oh,
laugh. Yeah. We
uh-huh.
watched something on the TV, and then he was this funny little guy with short hair and glasses, and he starts at nothing, cracking up, laughing, like faking laughing. And
Uh-huh.
then you kind of start like, like fake laughing, and you're laughing like that. And it just, oh my God, it just gets everybody going. And it's so hilarious, and it gets, like, your blood vessels get going and your cheeks get red, and you're using
Oh.
your body and the oxygen flows. Like, it's crazy. It's the dumbest thing, but it really is real. I mean, it really is real. It's
I mean,
so
it
funny.
was fake at first, but then at the end, I
Yeah.
was really laughing.
Yeah, totally. I know, because it's
Yeah,
so hilarious.
it's
And when
so
other
fun.
people are doing it and watching you, it's funny. So
Yeah.
yes, that is very, 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 very important.
One of the terrible situations that I was in, and, how how it how I ended up, it was just so unbelievable what had happened, and it was so terrible that we just ended up laughing at the end of it. I mean, even with the patient dying, we're
Yeah,
just standing there just laughing because there's no way that how did that happen? There's
right.
just no rhyme or reason to it, and I feel like I took us from a very
Yeah.
jovial
No,
place
it's
to
it's just
a kinda
it's
heavy
an it's
place.
well, it's unbelievable sometimes. And
Yeah.
I think the laughter, with its ability to shift, neurotransmitters and increase oxygen and decrease cortisol, and, all the things we know about it, it only makes sense, you know.
Mhm.
But, you look at like funny videos or stuff, just, in the night with your nurse friends, and
Uh-huh.
just laughing so hard. And those are some of the fun. And I'm sure nurses are like, when you're with your homies and you're laughing and like rolling and crying,
Yeah.
because
Yeah.
it's so funny, especially at night, because you're tired,
You
and
get
then things
slap
are,
happy.
oh,
Yeah.
it's so much more funny. But I think it all has a practical purpose, I don't think
Oh,
we
yeah.
realized it then, but looking back on it, like that, it's a way to cope. It was one of our skills.
I remember one of my friends and I were on call in the PACU one night, and it's late, and we're just sitting there waiting. Maybe we had, like, 2 or 3 cases. We got called in for one, and then they had an add-on, and,
Mhm.
and so we've got, like, all this time, and I had this bread, and we're just like, we're sitting at the nurse desk waiting and talking, and I'm eating a piece of bread, and the bread just crumbs up
Oh,
and down my scrubs.
yeah.
And I looked her right in the eyes and I said, you know what? I feel really crummy.
Yeah.
And we cried. We cried for 10 minutes. We cried for 10 minutes. I mean, and we still laugh about it. I'll text her every once back. I'm
Yeah.
going to text her after
I feel
this
so
and be
crummy.
like, I feel so crummy today.
Yeah. Oh God. I know. I know. They're really they're I mean, I mean, I hope other nurses have had the experience that we've had. I mean, I think there are. I think they
Yeah,
do.
yeah, for
I
sure.
know. I mean,
Yeah.
I think it'd be fun to have other nurses on the podcast and just like one of the questions we can ask them is, tell us a funny, a funny story or something that made you laugh when you were nursing or something that, cut the tension.
Uh-huh.
Because I bet there's
Oh,
everyone can
yeah.
probably think of one time, at
Oh,
least
yeah.
one time. Yeah.
Yeah, for sure.
So not only do nurses use humor amongst themselves, and that's pretty much what we're kind of focusing on because everybody kind of knows, humor in medicine and humor in healing and,
Mhm.
with your patients. And, sometimes you really have to use it because the patient's scared, patient doesn't know, and you're trying to cut the tension for the patient because they can't do it and
Oh,
part of our
yeah.
job is to make them feel more comfortable and using a little bit of lightheartedness, and being able to read who you're talking
Read a
to.
room, yeah.
Yeah,
Yeah.
is really important, but I think has been, you know times that I've done that and lightened the mood, it has made the conversation just so much easier.
Mhm.
Like when I was a supervisor and I had to go into a room with angry family, or like
Uh-huh.
pissed off or something, it's I mean, you could keep the mood serious and be, all supervisory on them, or you could
Uh-huh.
just sit down with their level and say, what what's up? Like
Yeah.
what's going on? Or not like I'm trying to tell a joke, but it's really just bringing that light-hearted energy to a very heavy, you
Very
know,
heavy.
yeah, it's and uneven. Like I'm not heavy,
Mhm.
but they're very heavy and they really
Sure.
just need to kind of come up more to take a breath,
Mhm.
realize what's actually important and what's going on. And,
Yeah.
I think it's kind of the same thing. So, you talk about kind of social bonding and doing that. It's a way to create a bond with them so they know that, I'm on their side. Like I'm
Right,
on
yeah.
your side.
Sure.
And let's, we whatever this is, we can figure it out and move on from here.
Mhm.
I mean, there were the ones that you couldn't crack.
Sure.
And that's fairly obvious and comes very quickly. So you kind of know that like, okay, we're just going to be serious here. So that's
We're
fine.
just
Yeah.
we're just gonna stay on the left side of the brain.
We're just staying on the left side. We're not going to use the right side. No creativity whatsoever.
Yeah,
None.
no.
Yeah.
I
Yeah.
think nursing is a tremendously creative
Oh,
act.
yeah.
I mean, it's like when I worked on the floor, critical care float pool, I can remember being in situations like I had to, I can't remember, it was I was emptying something like a gastric tube or something. And I didn't have a graduate. So I just took my glove off and I just
There you
dropped them in
go.
there. Like, I mean, nurses are so creative.
Oh,
I
yeah, you're
That's
right.
the easy one,
Yeah,
but, because
hilarious.
you can't unglove, you can't reclamp, you can't
I
like, if I
know,
do that, like, I'm never gonna get my meds passed over here, like,
right.
I got this other dressing change I have to do. It's like, I gotta figure out how to make this work right here, right now, and
Yeah.
so I can keep moving.
No, it's super creative and it's not even like thinking. I mean, it's thinking of creative ways, but it's so intricate and there's so many there's so many ways you can do things, and I'm thinking of like a coloring book, like you have to you can decide what colors you want to use. You can decide if you're going to draw in the lines or out of the lines. You can decide whether you're going to color on the back of the page, on the front of the page. in nursing, it's kind of that way too. Like, are you going to pass your meds first? Are you going to go see all your
Mhm.
patients first? Are you going to, and then you kind of find what works for you. So, that is a lot of right-sided, brain
Mhm.
activity. But then there's also the heavy left-sided, which is, managing drips, figuring out,
Mhm.
meds and looking through the chart and putting labs together and figuring out the ABG and what you're going to do, how you're going to call. And, that's all critical, left-sided brain thinking.
Mhm.
And so to marry the two, I mean, I think humor marries the two, really, if
For
you think
sure,
about
for
it.
sure.
Yeah.
Yeah, and that's kind of what I was gonna say, like, creatively, like, in my wood art, one of the observations that I've had for a long time of what it is that I'm actually doing
Mhm.
is that I have to go into that creative dream state in order to have the idea that of where I wanna go creatively.
Mhm.
So, without that, it doesn't matter how much like, what are you even gonna plan? If you don't have a vision for where you're going and what you're doing, how does that left side what good is the left side? If you're
Right.
just left side, you're planning and you're reasoning and you're, you know, thinking, what is the thinking for if you don't know where you're going? And so you have to have the 2, and I think nursing is it's so creative because like even that description of the of you know putting the gastric juices in the glove or whatever it was. I don't even know
Mhm.
what it was.
Mhm.
That idea was driven by the left side thinking and planning all the next steps that I have to take.
Mhm.
So that was the creative me, going into a creative space that gave me a plan forward.
Mhm.
So it's very much marrying the 2.
Yeah.
Which is it's super interesting, like as we kind of talk through humor in nursing, that what it really comes to is creativity and consciousness and our brain that
Yeah.
working having our brains work together and not being because being just in that left side of just thinking all the time is so constricted and so
Mhm.
limiting it
Mhm.
just keeps you stuck and going into that like having I think this is like I've always advocated for nurses having nap time
Yeah.
that we should have a mandatory 30-minute nap in the middle of our shift or,
Mhm.
at any point that it's, late in the afternoon, whatever, wherever it's right for the nurse. But just to have that brain reset so you can come back and get out of that constricted mind space of just planning.
Yeah.
So much planning goes into nursing.
Yeah.
It's crazy.
Yeah.
Yeah.
Well, and I think just in our lives too, and I've used a lot of humor in healing. I know when I quit drinking and I was doing, a lot of sobriety work, it was a lot of laughter. We used laughter a lot. And I think that is to engage your creative side because
Mhm.
we push through so much and so often and every day to get everything done and everything done on our list and we push, 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 push with that left side and neglect the creativity part of our lives. And I
Mhm.
think that's where you can go off the deep end. For me, that's what it was. I wasn't allowing myself to be creative more often than I
Mhm.
needed. It
Mhm.
was serious at work, serious, with life, raising the kids, doing everything like that. And like I didn't have time to do the things that I, wanted to do that were creative. And the consequences of that is for me, it was just a breakdown. It was a breakdown
Mhm.
of almost like I couldn't do anything anymore. I couldn't really
Mhm.
even think.
Yeah.
And I mean, the importance of bringing using your hands, using your imagination, you know, and you don't even have to be good, but like
Mhm.
painting or drawing
Uh-huh.
or, creating or wood or clay or chalk or, it's just whatever whatever matter or whatever you're, crocheting, and again, using your hands, all of those things, like creative outlets, if you want to say, but there's a reason for it. There's a reason. And once you're engaging both sides of your brain, it just works better. It works better. Your anxiety is less, depression is less. You can think more clear and honestly probably get more things done. I feel like I get more done now. I mean, I can have more on my plate now than ever before. And I'm like, that's a lot. I've got a lot going on right now, but keeping in my practices and my, I do watercolor or drawing or coloring. I like to color too, but making time for that, like you make time for your woodwork. It's not just like you're making wood and you're making things so you can sell them. So it really is using that part of your brain that expresses your creativity, which I think then makes your left side of your brain work better,
Yeah. I mean, I was kind of thinking about that, like, because I think people in my life didn't really understand the journey that I was on creatively. They didn't understand the creative journey that I was on. I didn't really even understand it.
Right.
And that's why I really threw myself so heavily into that creative side. I had to get this out. Like I did, because again, back to the fact that nurses, it never dawned on me that I was having PTSD, that I was experiencing post-traumatic stress.
Yeah.
It just never even crossed my mind until I went through Warriors Ascent, and it was just like, oh my God, like how is everybody not talking about this?
I know.
What's wrong? Like it's crazy.
Yeah.
And so you can also go too far into the creative realm. You can go too far onto either side, and it can get unhealthy. Yeah. And I think, I also think that's the maladaptive behaviors that people go into. It's escaping that dominated left side. Go drink, you kind of, because it lets down those inhibitions. You laugh more, all the things that we're talking about.
Yeah.
Same thing with, with sex, like I think that you are escaping the reality that you're in, and you're focused on just one thing.
Yeah.
And that when you don't know that that's what you're doing, it can be very destructive.
Yeah. And you don't even really know that you don't even know it's destructive because, everybody else is doing it. And that's what everybody does,
That's just what we do.
It's just what it does. And so these maladaptive behaviors that, the gambling, the shopping, the, being online, sex, drugs,
I mean, I'm not a gambler. I don't particularly enjoy throwing my money away like that.
Right.
But it just dawned on me like that the idea of the possibility of a big windfall of money is a creative act. They're engaged in their creative thinking when they are. When you said that, it just kind of was like, oh, a little light bulb.
Well, and they're all a form of disconnection. And I think it seems like it could be a disconnection from just dominant left-sided thinking. And not embracing your creativity, your natural creativity. Everybody has natural creativity. You don't have to be, an excellent, artist. That's not the point. The point is expression. That's what it is. It's creating. Yeah. It's creating, gardening, making your garden, things like that.
Not ICU garden, not ICU gardening.
No, not ICU gardening.
Yeah.
No. Oh God.
Because that's that's the thing. Like my creative journey began with a song that I wrote with a friend who's a professional musician. Long story. won't tell the whole thing.
Mhm.
Went from going through this extremely creative experience, and the very next day after we were done, I had 2 trached and pegged patients that had really no brain function. Recognizing the seeing the invalidity or the infirmity of these people and all the potential that's in the body, and that there was no creativity left.
Yeah.
That's really hard. And to go from being so creative to like managing people who are essentially dying
Yeah.
is the opposite of creative.
Yeah.
It's, I mean, it's definitely a special place to hold as a fellow human being that's assisting this person that's going through this. For
Yeah.
sure, a special place. But for the for the side of me that needed creative expression, especially at that time, it was very hard to see that and see that potential of that human potential just laying there.
Yeah.
And that really, I think that is one of the fuels behind my creative work today still. I mean,
Yeah.
just I have to do something creative.
Yeah. It is so great. I've never really thought about that. A lot of, especially an ICU nurse, a lot of our work is taking care of intubated, sedated patients that have
Mhm.
no communication really, except their vital signs, but it's not a connection. There's no connection. So it's almost like we're caring for these bodies and
Mhm.
without emotion. It's
Mhm.
very weird
Without
that
any of the biochemical connection
or,
that
the like feedback, like social
Mhm.
feedback, you
Yeah,
know?
yeah,
That's interesting. It all you have to do is say intubated and sedated, and the ICU nurse knows exactly what you're talking about.
yeah.
Sometimes those are your favorite patients, like, because I think it's so I mean, you're engaged because you're taking care of the body and the vital signs. Like you're taking care of the energy of the body,
Mhm.
the electricity of the body, the heart, the lungs, the brain, but there's no emotion
Uh-huh.
involved.
Yeah.
That's that has to that
It
has to
messes with us. Yeah.
yeah,
I mean,
it
that's
is.
why I'm in the PACU. That's why I always tell people I work in the recovery room because 'cause I'm in recovery.
Yeah,
The thing that is healthy for me in the PACU is that I get people come to me in that not necessarily, I mean, intubated and sedated state. They're
yeah,
asleep.
yeah, ish, yeah,
Yeah, they're not functional,
right,
and, I get to guide them back into consciousness,
right,
and then they get up and they go home, and
yeah,
generally, they're very thankful for the
yeah.
work and the help that I've provided them, and they are able to express it. These ICU patients, you know,
Well, they
maybe
just
they get
transfer to the
trached and
floor. Yeah, they
they
transfer to the floor
die.
and then
Yeah,
you never see them again. Yeah, or they die.
or they
Yeah,
die,
never
yeah,
see them.
yeah.
Yeah,
So the psychology of seeing people get better has helped me reframe nursing because when I
yeah,
left nursing, and I think that was it was a needed decision, but it was also an uninformed decision in that the camaraderie and the community of nursing is so important because we are siloed. We're
yeah,
siloed in society with these experiences, and to go out into the broader society without anyone in my life that had any healthcare experience or understanding of what was going through, I just looked crazy, and that you know I guess if there's a warning in there from my choice to leave bedside nursing, it would be to do it properly, do it safely, and stay connected to your nurse friends.
yeah,
Don't just walk away because that just leaves you more isolated.
yeah.
Yeah.
Well, yeah. I mean, you weren't in a good place, and I mean, I'm sure if you're thinking about leaving the bedside, you're probably not in an awesome place, but it's necessary sometimes to step away. But the bonds that you've made with the people that you've worked with, I don't know, it's just like you have to care for yourself and you have to be precious, with it because you're damaged and hurting and walking away might be necessary, but it doesn't mean you're not a nurse. It doesn't
Yeah.
mean that you didn't have any of those experiences. And it
Mhm.
doesn't mean, and you really can't shut it off either. I mean,
Nope.
I thought I could, but you can't. It's
No.
just always there. I've talked to nurses who have been out for years and who are like, should I pick up a shift in ICU? Like I could just pick up like one night shift. What? No. Are you kidding? Or like we're so desperate on nights. Could you pick up the wheat or son? And I'm like, sometimes I'm like, well, I mean, what? No, no, you're recovered. We don't do night shift anymore. That is for someone else. We don't do that. We do not do that. No. So no, it never leaves you. And so I think, yes, to be informed of just sometimes you just need a break and, you know,
Yeah.
fine. And sometimes you just need a different area of nursing. I work
Yeah.
in I work PRN in the recovery room, like PACU, and
Mhm.
about once a week I work. And it is just what you're saying. It's so, I want to say the F word, refreshing to like they're literally healthy. Like not a lot of people, especially in this outpatient PACU, not a lot of people are sick when they come in for a surgery. They're not.
I'm still laughing at your non-F-bomb.
Well, that's how it feels. It's very
Yeah.
refreshing, and you just said it like that. It's because most of my career has been taking care of such sick patients.
Uh-huh.
Hey, I don't mind. And when I work in the ER sometimes, I don't mind a this or that coming in every now and then, but
Mhm.
it's small enough. The majority of the patients are like clinic patients, and so that's fine. And I don't mind it every so often, but I do enjoy wheeling the patients out to their car. I just wheeled patients to the morgue. That's what
Right.
I
Right. Yeah, yeah.
Yeah.
That's where we used to take patients. Yeah.
Yeah. I think we've talked a lot about it. Kind of took us over into something else, but I think that was very important. But I think wrapping that up, it, it humor, and I can see it in my mind. Humor seems to be the go-between for each side of the brain, to kind of connect to those.
Mhm.
And
It's like a bridge.
it is a bridge. And I
Mhm.
think that is important in nursing because, two things: using the creative part of your brain, shifting the consciousness in the room, changing the neurotransmitters, decreasing, the cortisol from your stress. It just it breaks it, and it, kind of lowers it quickly.
Uh-huh. Yeah.
And there's and also between each other and with
Mhm.
your patients,
Yeah.
using humor with patients is funny because they're nervous, and we joke. I joke a lot. It's easy to joke with like PACU patients because they're you
Uh-huh.
know they're pretty nervous usually, and they're not really listening anyways because they're nervous, and you know and again about the question about or the comment, don't drink alcohol, don't drive your car, don't sign any important
Uh-huh.
papers.
It
Yeah, and don't make any important decisions. Well, Fred, we can't go to the bank. I guess we can't change the will today. I don't know. No, you
Mm.
can't. Nope. For the
Yeah,
70th.
you know what, another thing that I always say in that conversation is no important decisions and no online shopping or social media because you might say something or buy
Yeah.
something that you regret.
Oh my God.
And then I'll always throw in something like, "I know you want that bass boat, but,"
Yeah.
and then the
Not
wife is
today.
like, "No, no bass boat for
Right. Yeah.
you."
Yeah. Yeah. Oh, great.
Oh,
Yeah.
no.
Oh, yeah. Oh God. The wife sitting there. Oh God. It's
Yeah.
so funny. It's so funny because it's so relatable and it's so true.
Yeah.
Yeah, I know. That's so
Oh, it's
funny.
funny. Everyone has C. diff spores in their gut. We all have it. Everyone has it. But our good bacteria produces enzymes that lock the spore closed. So essentially, the spore has receptor sites that the enzyme attaches to that deactivates the spore. And when we take massive loads of broad spectrum antibiotics, that good bacteria is killed, and that enzyme it no longer exists, and it has to be perpetually created. So when that enzyme is taken away from the spore, it allows that spore to open and activate, and it creates this spherical ball that grows razor blades basically in all directions around that ball, omnidirectional razors around this spore body. And then it just lacerates the intestinal wall and makes you terribly sick.
Yeah.
And can kill you. That's why it's so important to limit your antibiotic use. That's why it's important to supplement with appropriate probiotics. That's why. We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below, or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.